just reminding us that if we don't have good health, if we don't have access to health care, it's pretty hard to be happy, at least for a lifetime. So I say that as sort of a preface, Mr. President, to what I want to say now is not everybody who's eligible for health care, who needs health care, is covered. We got a lot of people who get their health care from employer-provided plans. We got 300 million people in all who get health care coverage in this country. Half of them from employer-provided plans, about 25% from Medicaid, about 15% from Medicare, and there's about another 10% that in some cases don't have any coverage. There's about 20 million people who have no coverage. We have a lot of people who now get their coverage from the exchanges. Every state has their own health care exchange or marketplace. A lot of people are getting their health care. A bunch of people also use federally qualified community health centers in states on the East Coast, in the Midwest, and across America, where they have 10 cents or $10,000. You can get health care at these places, and that's good. But a lot of people who could sign up and get their health care in the marketplaces in each state don't know about it. And there's an opportunity to enroll in the marketplaces and get their health care coverage by midnight on this coming Sunday, on December 15th. And I just want to spend a couple of minutes reminding people to do that who don't have coverage and telling them why it's a good deal for them and for their families. There's some good news here, and so the good news is that all across our country, folks have four more days to sign up. And there's also some more good news, and that is that after going up for years, the cost of premiums in the exchanges and the marketplaces actually have dropped this year. In most marketplaces, I think of the average reduction is premiums are down about 4%. And for the next year, and in more than a half dozen states, premiums are coming down by double-digit rates of inflation. Delaware, our cost of health care in our marketplace, starting for coverage beginning January 1, is down by 19%. And what's happening here is after seeing a number of years where healthcare providers, healthcare insurers, were dropping out of the business of offering coverage in the marketplaces, they're starting to offer coverage again. 23 insurers offered coverage in states this year that those insurers hadn't been offering coverage. Beginning January 1, I think it's about 45 more will start offering coverage. And that means we're going to have some competition for customers, for folks who need insurance. And that competition will help create what I call a virtuous circle or virtuous cycle and help bring costs down even more. More choices, more competition, that is a good thing for our consumers and states across America. But wait, there's more. And this year, 3 out of 4 customers can find a plan for less than, you ready for this? $75 per month. Think about that. 3 out of 4 customers can find a plan on the marketplaces, in the exchanges, for less than $75 a month. And some people might be wondering if the Affordable Care Act, the marketplaces, is the right choice for you or your loved ones. That's a good question to ask. The marketplaces provide quality, affordable health care, coverage for Americans who don't receive affordable health insurance through their employer. For instance, last Friday, I want to mention a couple of people that I've been talking to in my state just in the last week or so about health care coverage. And last Friday, I was down at a place called Lewis, Delaware, which was first colonized by the Dutch 400 years ago. It's the first town in the first state, Lewis, Delaware. I met there a fellow who's a self-employed artist. His name is G.W. Thompson. And his life was forever changed by the Affordable Care Act when he was able to find affordable and comprehensive health insurance. And if for folks that are waiting to start a business and need health care insurance, I would encourage you to do this. Visit healthcare.gov. I'll say that again, healthcare.gov today. Find a plan that works for you. Got plenty of choices. Earlier this year, I met a widow in Delaware. Her name's Marie, and she lives with a pre-existing condition. As it turns out, there are tens of millions of people in this country who live with pre-existing conditions. And for many, many years, they didn't have access to health care because they had a pre-existing condition. That's not the case anymore. For folks who do have a pre-existing condition, they can get access to health care. And thanks to the excellent staff at a place called Westside Family Health Care. That's one of the federally qualified community health centers. And they have a great place in Dover. But anyway, Marie was able to go there and enroll in an ACA plan. that covers her pre-existing condition and helps to keep her happy. Let me just say to the folks across the country, if you are one of 133 million Americans living with a pre-existing condition, I urge you to visit, again, healthcare.gov, healthcare.gov, find a plan that works for you. If you are a young person who's just turned 26 and can no longer stay on your parents' health plan, visit healthcare.gov today and find a plan that works for you. If you or your family have tried to enroll in Medicaid but did not qualify, visit healthcare.gov today and find a plan that works for you. And don't forget, nearly 9 out of 10 customers are eligible for financial help, which could mean a big savings for you and your family. But the deadline, I've said this before, I'm going to say it again, maybe a couple times, but the deadline to enroll in the affordable, one of the marketplaces in your state is this Sunday. It's a Sunday at midnight. And so you got 4 days. And depending on which time zone you live in, maybe close to 6 hours in order to sign up. Don't wait another day, though. Sign up today. Go to healthcare.gov now through this Sunday, December 15th, to shop for a plan that will give you and your family coverage through 2020. You sign up before by midnight this Sunday, and you have coverage beginning January 1 through December 31st of next year. I know there are a lot of things that always have to get done before the end of the year. This is one that I think is too important to miss. Too important to miss. So one more time, visit healthcare.gov today to find health care coverage that works for your family's needs and your budget, regardless of what state you live in, if you have no coverage. And Mr. President, I want to end this by saying, since the Affordable Care Act was enacted, we've seen some, not all, but some of our Republican friends here in this body and across the country do their dead level best to undermine the Affordable Care Act. And those efforts ramped up considerably under the current administration, when the president and 18 Republican attorneys general had gone so far as to file a lawsuit that attempts to scrap the health care law in its entirety. That lawsuit is working its way through the courts now, but it's important for everyone to know, despite these efforts to sabotage our nation's health care law, the Affordable Care Act is still the law of the land. And if you want to sign up for coverage for next year, you can still do that until midnight on Sunday. So I don't think there's a reason not to sign up. And I would urge anybody who's out there listening, watching, you don't have coverage, let's do it. Do it today, and you'll be glad you did. And the idea of life, liberty, and pursuit of happiness will be a little bit closer to being realized for you. And with that, Mr. President, I yield the floor.